Welcome to the Rapid Change Matters Rapid Fire Question Round. 2 minutes to expose the attitudes, beliefs, recommendations and perspectives of all things change work. My name's Howard Cooper and I'm joined today with, give us your name and what you do.
I'm Kate Beaven-Marks and I'm a clinical hypnotist and a hypnotherapy trainer.
Thank you, Kate. Your time starts now. What's the worst advice currently being given out within the world of change work?
The worst advice, I think, is that if it doesn't work, it's the client's fault.
If you had to reread one book about change work 100 times, what book would it be?
Well, I've got over 1,000 books and hypnosis recordings and resources, so that's a bit of a choice. I'd rather use the 100 opportunities to revisit some of the diverse range of books that I've got and actually read and enjoy them.
If you could have a personal one-on-one session with any therapist or change worker, past or present, who would it be?
I think it would have to be Frank Farrelly of Provocative Change, purely because his work is so outside my professional comfort zone that it would be really interesting.
Can you think of a concept or an idea that you used to believe was true but have subsequently changed your mind about?
I can. I think that would be that you have to have a positive regard for the client for it to be effective. I've seen people work who clearly really didn't like their client, yet they were able to generate positive change.
Knowing what you know now, what advice would you give to your 20-year-old self?
Organise your hypnosis recordings and resources better and use them fully. And when you go on a course, really engage and actually use it afterwards, because then it integrates it all.
What is the most successful change work related result you've experienced on yourself?
I spent 6 years doing my hypnosis research for my doctoral degree. Lots and lots of change, but I think the most effective is the one in the last year where I've lost 7 stone.
Most important belief for a change worker to have?
Work with what the client wants to achieve, not what you think they need.
And final question, what do you believe is the biggest misnomer people have about the work you do?
I think there's 3 elements. People believe that there's a magic wand. They believe hypnosis and hypnotherapy is fluffy, and they believe that there's no evidence base. And they're wrong.
Time! Thank you, Kate. And to hear a bigger, fuller, more in-depth interview with all things Kate Beaven-Marks, along with detailed interviews with other leading therapists and agents of change, simply visit rapidchange.works.